morning, I'm Dr. Rebecca Marchman. I am a GP. I work in Salford, but I also work as the clinical lead for dementia as part of NHS Greater Manchester. So my role is to work really with Sarah and the Dementia United team to provide support for those with dementia across Greater Manchester.
My name is Jacqui and I'm CEO of the Lewy Body Society. We are a Wigan-based charity, but with a national reach. We operate in England, Scotland, Wales, and Northern Ireland.
So hi, my name is Sarah Kirkland. I'm one of the senior project managers with Dementia United, working with Becky. I've been with DU for 4 years, lead on a number of work streams, including research and improving quality of diagnosis. Particularly interested in research because before I came into this role, I delivered dementia research for the National Institute for Health Research in Bradford. So I was carrying out a range of assessments and interviews with people living with dementia and their carers. And I was also a carer for my mum who had vascular dementia.
Obviously, in my role in general practice, we see people of all ages, but I think I've always been passionate about people sort of older age care because I was very close to my grandma as I grew up. And I think one of the things I've certainly seen, certainly coming out of COVID, is the impact that COVID had on the ageing population in terms of isolation, in terms of being able to go out, socialise, physical mobility. So we've seen an awful lot of frailing coming out of COVID. And really, I think that the population, the older population, but also those, the younger population as well, struggling with dementia, it can be a very frightening and isolating time for people. So my passion is really to try and reach out and help support those people who are going through a life-changing diagnosis, but sometimes don't know where to turn to.
My background is actually in financial services, but my dad had a diagnosis of Lewy body dementia. He was actually diagnosed by his GP in Wigan before there was a memory service. So he was actually, as we say, quite fortunate that he had a really knowledgeable GP. But now I work full time on the charity, the Lewy Body Society. My passion is around making sure that people, to the best of our ability as a charity, get the correct diagnosis, because it's about quality of diagnosis, not just for Lewy body, but for all types of dementia, because if you don't get the right diagnosis, you don't get the right care, you don't get the right support, and certainly don't get the right medication. We as a charity are a member of the Association of Medical Research Charities, and we've currently funded 3.4 million across UK universities through voluntary donations. I work with Dementia United and especially Helen Pratt as part of the young onset and rarer forms of dementia subgroup. And it's so important because we're seeing a lot of people, even in the Lewy body space, being diagnosed younger, much younger, in the 50s, and some people in the 40s. A lot of people with the diagnosis of Parkinson's under the age of 65 are going to go on to develop Lewy body dementia or dementia with Lewy bodies.
Yeah, for me, very similar. My mum had vascular dementia, but my particular interest in young onset dementia, again, came from the research that I did. And I worked on a number of projects that have sort of since gone on to influence clinical practice and commissioning. So I interviewed people for the Angela project, which was looking at consulting young people living with dementia and their families. It was an international study, the largest study of young onset dementia ever carried out in the UK, and to basically raise awareness of inequalities and to provide evidence-based recommendations for good practice. And that's what it went on to do. But what the Angela project did was pulling out this sort of the best practice, so where people had good experience, to the recommendations went on to inform. I also worked a study for Lewy bodies with University of Cardiff called DLB Genetics, which was looking at taking blood to sort of look at biomarkers for commonalities with Alzheimer's disease, Parkinson's. So as well as the sort of clinical aspect of taking the blood, so there's also always taking the case histories, how the dementia Lewy body has progressed.
It is about understanding why somebody's memory is deteriorating, but also ensuring that they're getting the care and the support, the right medications, and that the family as well get the support they need. there's a big misconception that dementia only affects the elderly. And I think exactly like Jacqui said, we are now seeing a lot of people being diagnosed with dementia earlier on who are struggling. They're of age where they're trying to maintain a job. They may have children and grandchildren. They may have a mortgage. So in order to support their independence, it is so important that the public are aware that memory problems can happen at an earlier stage. And the sooner that we help with that diagnosis, the sooner that support can start.
Yeah, I think just following on, last year I personally took 400 calls from families in crisis, and that was across all the spectrums. We're seeing people diagnosed and with symptoms who are struggling to get a diagnosis. One person over the last couple of weeks, 28. Obvious that this person has very clear symptoms, but is really struggling to get a diagnosis. And there's the symptoms that people are displaying. We get people diagnosed with epilepsy. We get people diagnosed with bipolar. Because, there are overlapping in some of the symptoms. And this is the struggle for people with an early onset of symptoms to get a diagnosis of dementia. Some people are just getting a dementia diagnosis and not a subtype, whether it's vascular, frontal lobal. And it does make a difference, because somebody with frontal lobal potentially is going to be non-verbal in a few years. It's really important that some women will get diagnosed with menopause. Yeah. And it's because the symptoms, these are the symptoms, you've got the menopause or early onset menopause. It's so important that people are listened to and that families are spoken to as well, because it needs to be that whole holistic picture before the diagnosis is given.
Yeah, it's interesting what Jacqui says about the families being spoken to, because the one common thread through all the interviews that I carried out with the sort of like the carers and of the people that had young onset, the common factor was an adult child who pushed and pushed and pushed, and they said, we knew something wasn't right, when somebody came back with a diagnosis and menopause, as Jacqui said, but also anxiety and depression. And there are some, there's crossover, we all know that. But it was that, and it struck me then that it was purely down to this adult child going off and doing their own research and pushing and going back and saying, no, this isn't right. I know, Mum, I know, but there's more to it than that. That's the thing that struck me about and that's what the study was about, the quality of the diagnosis. But it is
the misconception that dementia only affects the older people. That's the biggest misconception that we really want to get out there, that it's not just memory. And I think that's something that really needs to be highlighted. There can be personality changes, mood changes, and that can make the diagnosis more difficult, because as we've said, there's a lot of overlapping conditions. There are more things that are more common in that age group that maybe doctors will jump to that conclusion first, because that's the most common thing they see in somebody of that age group. So I think one of the sort of the big myths and misconceptions is that yes, common things happen common, but that doesn't mean we forget to look for the unusual as well. And I think we have to make sure that we keep our mind open to the fact that sometimes we might see the slightly unusual, the slightly rarer, and how do we keep ourselves open to those ideas, especially when, as Sarah said, the initial treatments we planned didn't work.
Yeah, I think, again, picking up on what Sarah said and Rebecca said, dementia is not just about memory. For example, somebody with Lewy body, it's about the cognitive behaviours. It's about the delusions. It's about the hallucinations and the paranoia. Memory, yes, that somebody might have memory problems a little bit, but that person will have complete moments of clarity. And we say to people, it's like flicking a light switch. Somebody can change by the hour, displaying mood changes, and then the next minute they're absolutely fine. And when you start to see those signs, it can be very difficult to diagnose. But my dad's diagnosis by his GP proves that it can happen. That, you don't necessarily have to go to a memory clinic. You don't necessarily have to have a scan. Because if the GP or your first line of medical professional knows that information. He was diagnosed on his first appointment, and then followed up with a consultant who said, yes, this diagnosis is spot on by the GP. So it is possible with the education. We get asked a lot about, is it genetic? Our research shows that it can be, Lewy body for in particular can be in families, but it's quite unusual to be in families, where you might have an Alzheimer's gene that can be in families. But it really is about those core things of stopping smoking, reducing your alcohol take, the things that we can all, and research has shown, reduce our risk by up to 40% of developing dementia. And interestingly, I did some presentations to some health and social care students, and it was surprising how little they knew about these things. So I think we really have to get right back to the grassroots about educating the students coming up. Health and social care students, they're going to be working, they're the future of the sector. So we really need to start educating from that level.
Again, just to go back to Jacqui's point about education, recently took part in a dementia awareness day at the University of Bolton, which is a great, and it was run by the School of Nursing and Midwifery, as you might expect, but it was aimed at the entire student and lecturer workforce, and with the kind of like the idea that the student nurses and OTs would be getting that really early access to the sort of like how to recognise dementia, and that kind of like awareness. But that's just one university. That's the sort of thing that does need to be replicated. The modifiable risk factors as well. Yeah, I'd love to see a public health. Yeah, I'd love to see. I mean, a public health campaign. I don't know what the chances of that happening now, but it would be fantastic. But I would love to see the 40 plus, the standard GP check at 40 plus to talk about dementia, and to sort of like to promote that, the healthy living, and some of the risk factors that people may not be quite so aware of, like the hearing loss. So if hearing loss is adjusted for, that can really help.
And in terms of sort of early signs and risk factors, so there's some things we know about early onset dementia, and there's still a lot of unknown about early onset dementia, and that's where the research is going to be invaluable as time goes on to understand more about those risk factors. There are genetic components that we're starting to identify and understand more about, but there's also risk factors. So we talk about things like diabetes, heart disease, high blood pressure. Actually, education around healthy living and healthy lifestyle can actually be preventative towards some of these rarer onsets, and it's really important that we include it when we're talking about our health promotion. We do talk about dementia as part of that, not just as part of preventing diabetes, but actually including dementia in some of those sort of public health campaigns. Really, there's so much to say about receiving that sort of diagnosis, because ultimately dementia is a life-limiting diagnosis. So to receive that diagnosis at such a young age, it's going to have immeasurable consequences on someone's life. For example, we talked about things like work and mortgages. If you have a diagnosis like that, immediately your outlook on what your future is going to look like is very different. You may have young children and you're thinking about, how am I going to care for them as I grow up? If you're a female, you're then having that discussion about, am I going to have children if I know that actually I'm going to have this diagnosis, and I know that my memory and my other factors are going to be affected? Am I going to go down that route of having a family or not? And I think one of the differences here is that because it's rarer, they're not likely to know somebody who's going through something similar. We're lucky in Greater Manchester because we do have Dementia United do work with the young onset and rarer forms, and we do have groups which meet to help give people that peer support and that encouragement. But I think it's a completely different diagnosis to receiving it to when you're older. The whole aspect on life is going to change.
We've had a few months ago someone in the 50s who had got to the point where they had to go into residential care in the 50s. You imagine somebody in residential care in their 70s, 80s and 90s. Our residential care system is not set up to take people at that age. The activities, the whole setup is just not. That's part of the challenge as well. You know, just people getting misdiagnosed is the big thing. People can take 3 or 4 years to actually get that final diagnosis. And if you think that somebody may have been started on a different medication path, some rarer forms of dementia, and for some younger people, that wrong medication can actually be so harmful and actually cost the NHS and the system more money. So this is why we need to actually get the correct quality of diagnosis, because that person might have children, might have other dependents. Again, the system is going to be put more under pressure because of that, because they're not going to be supported correctly.
I think, like you say, that as Sarah said, when somebody's diagnosed with a younger onset dementia, the impact it has on them is so significant that we do need to look at, and as Jacqui referenced, are our services tailored to spotting these rarer forms, supporting them and making that correct diagnosis quickly. And I think there's definitely work to be done around that in terms of education, but also what we're looking at as part of Greater Manchester, we're looking at how our dementia pathways work in Greater Manchester. So Sarah and I are working on a project at the moment around our dementia referral pathways, and we do, as part of our young onset dementia steering group, they did do sort of a public consultation to map where the gaps are and the challenges that these people face. So that's going to be incorporated into the work we're doing. Sarah will be able to explain more about that as well. But, you know, there are so many people. We've currently got about 2,000 cases on the young onset dementia registered across Greater Manchester. So this is not a small amount of people that we're talking about, and the impact it has on them, as we've said, you know, it's immeasurable. So there's definitely urgent work to be done. And
Jacqui's actually the co-chair of our young onset dementia steering group, and as Becky said, they recently carried out this public consultation to look at the gaps and the challenges with a view to developing a specialist young onset dementia diagnostic pathway. And this is going to map onto the larger piece of work that Becky and I are leading on to identify the most appropriate model for a good quality dementia diagnosis in general, and that will include the subtype, and that will then go on to be recommended for adoption across GM. So that's something that we're all working on this summer. But the work that the steering group did as part of the consultation, they looked at our current referral pathways, the assessment, the testing, the imaging, the investigations, and the diagnostic experience, the delivery of the diagnosis, as well as the initial specialist support requirements, post-diagnostic support and later life support. So they really looked at all the needs. They made a number of recommendations, and those recommendations will go towards creating this model pathway for young onsets and rarer forms, which will be published later this year. And we'll be making recommendations to adopt across GM. So like everything we do with Dementia United, it's always co-produced with people with lived experience. We had 60 sort of like separate people inputting into it, as well as services across GM. So watch this space.
Just to say, as a charity with a national reach, you know, we speak to people all over the country, and I think we are really fortunate in Greater Manchester with Dementia United because we hear so many stories where the delivery of the diagnosis is not great, where there's no post-diagnostic support from the memory service. I know in Wigan, for example, there's a 6-week course after you get a diagnosis from the memory service. In a lot of places that doesn't exist. So I think we really are great, you know, and when I go to conferences and meetings and I talk about Dementia United, because I always try to get it into the conversation, and the work that's happening with the young onset and rare reforms group, people are just amazed of what's happening within Greater Manchester. So I really do think that we're very fortunate.
You're not on your own is probably the only thing that I could say to you. You will have received a diagnosis that has probably really shaken you, really frightened you, or your loved one, and you're probably thinking, what's next? But what I would say is that there are some amazing support out there. Like, the work that Jacqui does is invaluable. So reach out, ask for help, get the support that you need. Don't face it on your own is probably the only advice that I could offer. Is, you know, you've probably had to fight quite hard to get that diagnosis as well. So there's probably an element of feeling maybe a little bit upset that it's taken this long to get there. But what I'd say is, you've fought, you've got there. Now make sure that you get the help that you need and you deserve.
Yeah, a lot of people tell us they're actually relieved when they get the diagnosis, because at least then they know what they're dealing with. They can plan. And we always say to people, exactly as Rebecca's just said, you're not on your own. There is help and support there. People telephone us because, as a small charity, everybody associated with the charity, we've all had a family member with Lewy body dementia. So we've kind of got the t-shirt. We can offer that personal experience, and we always say knowledge. Get as much information as you can, and support, because you will need it. And we always tell people to keep once you've got that diagnosis, to keep a diary to family members about changes in medication, appointments, changes in behaviour. Keep a diary, because you may need it going forward.
I would just like to make the case for getting involved in research. Obviously, getting that diagnosis is shocking and frightening, but when you have sort of got a little bit used to it, I can't recommend getting involved in research highly enough, because that's the way clinical practice gets changed. You know, the findings from the Angela project, the recommendations, which were based on people's lived experience, have gone to inform clinical practice. So, you know, people's lived experience of young onset dementia and any dementia really will go to help people, you know, to help people understand, clinicians to understand how we can best treat young onset dementia and how we can best look after people living with young onset and their carers. So I would always advocate for getting involved with research. With Dementia United, we have our own group called Dragon Dementia Research Action Group, our network. So that's the Dragon. So just if I could just give a quick plug for that, we meet 4 times a year in Greater Manchester. It's very informal, it's very fun. It's a little forum for researchers and for people living with dementia and their carers to get together and talk about research priorities, share their experiences. So more than welcome to come along to that. We'll make sure the details are sort of like put on the end of this broadcast. Also have a website called Join Dementia Research, which anybody can sign up to, and they get access to hundreds of studies all over the country. So again, we'll put the details for that at the end of this interview.